Scanos wagwego. Ewe hami ni giaso ga kona ni wakwenzo dan it watuna otayoni ni wagisho dan. My Ongwahoe name means she carries flowers. I'm from the Cayuga Nation and I'm Wolf Clan. So for me, I work here at Juddah's Place. I've been doing traditional medicine, herbal medicine, since I was like 18, like officially, like with my mom asking me to help her. And before that, I was just like helping her with like going picking medicine and everything since I was like a child. And so I did that, but I also had lived my own life and became a teacher, and for 30 years, and then I became a vice principal for 3 years, and off and on. And I felt like I needed to come and work with medicines, because that was one of the areas where we were starting to lose that part. So this is what I've been doing since 2012. I made that my whole focus for my like my work. So that's what I've been doing that since then.
Sago, my name is Amy Montour. I am a Haudenosaunee woman from Six Nations of the Grand River Territory, and I'm also a trained family physician. Most of my work actually involves Indigenous health. I'm still on a learning journey myself to learn how to embody Indigenous ways of knowing and to incorporate that in my practice. But the work that I do clinically in palliative care as well as adult medicine is all centered around making sure that Indigenous people have good access to good quality care. And the other work that I do is as an educator within the Department of Family Medicine. And my whole goal there is to really bring people around to understand the true wampum and what that means in medicine and in medical practice, and how we can honor both Indigenous ways of knowing and Western ways of knowing.
Sego sewa gwego galana uwe ni yangyat skaninge haga ni wakwan Juddah anuala niwagitaloda. My English name is Karen Hill. I'm Mohawk Turtle Clan from Six Nations. I am a family doctor in my work role. I'm also a mother and a grandmother and a pet owner. Right now in my practice, I was working with Elva and other people at Juddah's Place. The other thing is working with Dr. Montour at the Brantford General Hospital in establishing an Indigenous health consult service for Indigenous patients who have been admitted to the hospital there. And the other part is, while at Juddah's Place, Elva mentored me, and I did 4 years of training with her and her traditional medicine program. And I've recently signed up to finish my studies as a clinical herbalist through the Institute of Traditional Medicine. And that's really exciting for me, because then I will be able to fully, use those medicines in my practice.
Okay, well, thank you. So just to say a little bit about myself, I recently became a registered practical nurse. I am working a bit in the Six Nations community as well as in the Brantford area. It's a new role for me, but it's very exciting. I've had the opportunity and the honor to be able to meet quite a few people in our community as of late. I really enjoy that I've learned, I think, more from the people than I have been able to give. I'm still working on that, but it's quite an opportunity to be able to sit with our elders and meet the people in the community on our land, as well as in multiple settings such as hospital and in personal settings such as their house. I really came into healthcare more so with the expectation of you wanting to help yourself, but I think as I've come into it more, I've learned that being able to give back is the greatest gift. And so I'm hoping that as I grow in my learning of our traditional learnings and our personal learnings, as well as off community, that I'll be able to broaden my horizons and provide more holistic approach to care.
So for me, during this time, I've talked to people, I've talked to quite a few people about what are the things that they can do. Number one is food. And that's an underlying thing for many, many, many things. That trying to start to eat more whole foods, and even just like looking at our traditional foods. I use the traditional food guide that was developed quite a few years ago that shows the cycle of ceremonies and all the different foods that we're thankful for during that cycle of ceremonies. And I talk to people about that. And so now in the time of COVID, that's a huge thing. And even at the federal level, when I've been meeting weekly with Minister Bennett, and Minister Miller comes on occasionally. Today, we're doing an actual federal conference this afternoon and tomorrow afternoon, but talking about how the focus can't just be about getting the vaccine out to all of these communities, because the talk has been, oh, well, we need freezers and we need supply, and we will spare no cost at getting this vaccine out to the communities. And I just said, it seems futile to me if you're not also sending some good food along with that vaccine. If you're not sending meat and eggs and, like whole foods, vegetables, because you're just giving us a vaccine to build our immunity against one thing, but our whole immune system is being impacted negatively by the social determinants of health, of food insecurity and a lack of clean water. So in Southern Ontario, we're fortunate that we have access to clean water, so and food supplies. So I talk to people about that, and I talk about our own traditional medicines. What are the things that you can use to help to boost your immune system? A lot of our people are aware of what those things are. How to clear your house by putting it on the stove and letting it simmer during the day to clear the air, opening some windows. And then supplements, vitamin C, vitamin D, zinc, quercetin. There's some supplements that can be used that can also help to support the immune system so that it is able to mount an appropriate response if the person is able to, it does come in contact with COVID. So there's a lot of things that we can be doing. And stress, right? Like reaching out to other people, connecting through Zoom, connecting on the phone, so that they're not feeling the stress of being isolated.
Mm-hmm. I agree. One of the my favorite parts of my practice actually has nothing to do with Western medicine. My husband is a hunter, and he usually gets a moose and a deer each year, but it's far too much meat for just our family. So for several years now, for the elderly folks that I visited in the community, I've been ensuring that they receive some moose meat or venison. And if you really look at that type of meat, it's the leanest type of meat that there is. It's so healthy. It's so full of benefits for folks. And I feel like, making sure that these elderly folks have access to that type of meat is just as important as the prescriptions for their high blood pressure.
Mm-hmm.
Okay, I agree with both of you ladies. I too, that's part of when people talk to me about COVID, like prevention, and even when they have COVID, is talking about food as well. And I know from my mom, she always used to get us to have like the onion and garlic family, to eat a lot of that, especially like in the fall time and through the winter and in the springtime, and to go and eat that. And even when the leeks come out, to make sure we go get that leeks and make the leek soup, because she says it helps to clear things away from us. And so I talk about different kind of foods and oregano and different things, what we need, and even still like talking about the herbal medicines, because we can't go out and pick leafy greens, but if we stored our dandelion and we stored our clover and things like that, that's where the leafy greens can come in, but it'd be in a drink when we make our medicines with it. And also, just like what Karen says, encourage them to put their medicine on the stove and let it boil, and help to clear the air, and even suggest which medicines what they can use for that. And even at ceremonies, we had a pot of medicine on the stove at the longhouse, so that can go out into the air, so that it helps. At least we're helping. And like Karen was saying, open some windows up. And even with dancing, we open both doors up to help with that. So, and at home, this is what I also encourage people to do for themselves. And even as, and just like Amy, what you were saying about to turn to more to our deer meat and our moose meat and our fish, you know, to eat those things, and instead of like the other things, and especially the fast food, because, you know, like I talk with my grandchildren and tell them, you know, that's not real food, that food. You know, might look good, or even some of the vegetables in the grocery store, that it looks nice, but there's no nutritional value, and about where we need to go to get our foods from. So yeah, along them lines, that's part of what I do besides the traditional medicine, is encourage them with that kind of food, and to cook for themselves rather than to go to a restaurant, you know, because then you know what's in it, you know what's in there, or you can add things to it. You can add that oregano to it, or you can add extra garlic and things like that. So so that you can boost your immune system. And the medicines too would help to boost your immune system, and to drink tea. And so that's what I do as part of the service of what we have at Juddah's, is to help them with, encourage them along them lines as well.
Well, from my perspective, like just from a Western perspective, because a lot of people, they're like, well, you know, if they're disconnected from the land, and they're not, you know, they're like, oh, I don't know what that is, I don't know where to get it, and there's still a little bit of fear that we have, right? Most people are okay with cedar. I'll ask them to use emergency, which is, you can just buy it in the store, cheapest at Walmart, FYI. And it's just one packet a day, because it's high vitamin C, vitamin D, zinc. It's got the stuff in it that, and all of these things have been proven through Western science to be effective. Also, green tea is another one that's good. They suggest 4 cups a day, but my heart would be racing like crazy if I drank that much caffeine. But up to 4 cups a day, because there's this special ingredient in green tea that can help to support the immune system as well, right? Chaga is another one that you could put in your medicine too, and Dunascoria, or Squenta, which is wild ginger. That's another one we use a lot of. I use wild ginger with peppermint because it's so strong, and peppermint is like a calmative, so it's soothing. It can help even with that feeling of anxiety because you're closed in, to just make a tea out of that and drink that. There's so many things, so many things.
The other thing, what I also, like you say, like when they don't have access to medicines, but they can still get things from the store, is I get them to also to take cod liver oil, and I prefer it to be liquid, and I put mine in a smoothie. If I make a smoothie in the morning, I put it in there. You can't taste it, and you don't get that burping back and all that. But it's really good for us. That it's good for like our joints and everything, our bones and everything. That cod liver oil. The other thing too is you can get in a drugstore or health food store, is that elderberry syrup. You can use that too. That's helpful too. That's something that you can get over the counter and things like that. You know, so other than that, it's like what Dr. Hill was saying, like a good multivitamin, you know, and with your emergency, like that, you know. So those are some of the things that people can do, like aside from if they don't have access to the herbs type of thing.
I'd like to share a story.
Yeah.
I think we sometimes think, you know, if you sitting here and listen to Karen and to Elva, you start to understand how Indigenous medicine is every day. It's not you're going to a clinic, you're going to get a prescription and you're going to do this. It's an everyday, it's lifestyle, it's embodying all of that. And that's where I find Western medicine practitioners really face a barrier in understanding. And so a good story to illustrate this is I myself was looking after an Indigenous patient who was very, very ill. And no matter what we did from a Western standpoint, using all of the medications, all of the knowledge of, you know, physicians put together, we weren't making inroads and helping change the course of this woman's disease. But the woman said in an offhand comment, "I need corn soup." And, you know, the Western providers, they didn't quite understand. They thought she just wanted something from home. But we were able to get her corn soup. And the very next day, she was on her path to recovery. The very next day. And from a Western standpoint, people were like, oh, you know, that's just a coincidence. It wasn't a coincidence. This woman knew from her very being what she needed to get better. And if we had not listened to that, I don't know that we would have turned around her condition.
You know, I guess the thing I think about when I think about traditional and Western medicine together, like they're just ways of thinking. And honestly, when we did the research project at Juddah's place, what it really showed was that we are the medicine. We are. Elva is. I am. It's our relationship with the people that are coming through the door. It's our relationship with each other. That's what our people saw when they came there. It's like, wow, these women get along together and they're working from two different points of view. You know, they struggle with their own wellness, and we were always very open with even the things that we were doing for our own health. Like we're fasting, we're closed, we're fasting for these days. It's midwinter, so the office will be closed. We're going to reschedule your appointment. Those are the things that patients saw. Even so, though sometimes they complained because their appointment had to get rescheduled, in the end, they were watching us. And so Indigenous people working and bringing our gifts to bear for our own people is Indigenous medicine. That's traditional medicine. It's us taking care of each other. It's Amy hearing from the nurse, this lady asked for corn soup, and Amy getting it and bringing it there. That's, to me, what the big intersection is. It doesn't really matter that we're Western trained or traditionally trained or both. It's how we enter into the relationship with the people that are coming to us for whatever it is that we're carrying. And we bring that to bear to help them through that relationship.
And also, I also think it's like that holistic part, right? Because it, like when she asked for the corn soup, it could have been, okay, yeah, physical, you know, because of what corn soup is made out of and the nutritional value there. And, you know, and if you got ash, you know, you got ashes, lied corn, that has a different effect on the body. So that's the physical part, but also what about the spiritual part of her? You know, her own spirit, her own spirit of wanting something that's traditional to her. And so that can also help to boost her spiritual part, to help her to be like, okay, you know, feel more at home, or, you know, more able to support her spiritual side of her, you know, to help that physical part and the mental part of her, you know. So it could be that as well, eh? So the holistic part of the person. Yeah.
Mm-hmm.
I think just to
go ahead.
Oh, I think just to touch on that too is, like, as you were saying, Elva, it's the holistic part. And I think sometimes with Western medicine, we get involved in such like quick fixes. And as like Karen was saying, like it's an everyday thing. Like we can't just give a pill to solve these things. Like if you're not physically well, spiritually well, and like taking care of yourself and your body, how is one pill or one thing going to solve this problem? It's not. We're just masking it.
I absolutely agree. And the one thing that one of the very first things I learned from Elva was that you can't practice medicine just from here. It has to be here and here. And when I started to realize that I had to get out of my head and connect it to my spirit, that's when I started to feel like I was really doing something that I was called to do, that I was meant to do, and it was going to benefit the people around me.
So for me, I guess when I think about the vaccine, and I've had a lot of questions about it myself, that I've done a lot of like research and Googling, and I need pictures to understand for my own, for my own knowledge, so that I can share that with other people. I mean, one of the things that Dehahande reminded me of, like traditionally, we didn't put things into our bodies, like foreign things, that we're related to the plant world, and that's why we would choose to use those plants for us, right? But I think we're at a place now. There's something happening in the world. There's something happening that's shifting in the world all around us, and this time of being fearful and afraid and disconnected and seeing ourselves as separate from other people in the world, that time has passed now. And we're stepping into a new era of being that is an era of connection at a very core level of who we are. And I would, encourage people who are feeling that fear that comes from the past and from that historical relationship that we've had with the overall Canadian society and the medical community. If it is the fear that's keeping you from moving forward, that's the time to reach out to people who can help you to heal from that fear. Now's the time to heal the roots of those things that we're carrying, so that we can make informed choices about how we will proceed. Because it's true, in Akwesasne, they have so many deaths there in the nursing home. So many people are being lost. We're not seeing it at Six Nations, so maybe it's not really on our radar. But when I talk to my colleagues like Ojisto Horn, and she's just weeping because there's nothing she can do, because people are still a little bit functioning from that fear of not wanting to fully step into using some of the things that Western medicine does have that are available, even if it's wearing masks and self-isolating and not going in to visit your elders often right now. There's a fear around that. So that's what I would really encourage people to do. If that's where you are, if it's the fear that's there, seek the help to come through that fear, so that your decisions are not based in the fear, that they're based in connection, in truth, right? That's what I would say.
I think it's important when we're making our decisions about even our own personal health care to always remember the principle of the seventh generation. What decision am I making right now that is going to impact my great, great, great grandbaby? And I try to live that in my life, and I try to encourage that in my medical practice, because oftentimes if we're making a decision out of fear or under duress, we're not thinking in that way. And for Indigenous people, we need time to just settle and to chew on it. We need to think about it. We need to roll it around. We need to process it and understand it in a way that makes sense to us. And we need to be conscious of the fact that the decisions and the choices and how we live our lives every day is is being watched by everybody around us. One of the most important things my parents told me was, the way you live your life is the sort of the education book for your children. And it's not the words coming out of your mouth, it's how you're actually living your life every day. Because you can say be honest and tell a lie, and your children see that. So when you're thinking about the vaccines, search out places where there is good information, like the Center for Wise Practices. Search out your local Indigenous organizations who are collecting the wisdom of our elders and putting it together and presenting it in a way that makes sense to us. In this digital age, we have ways of accessing this information. And even if it's an elder who isn't digital, their grandchildren are digital. So, think about how everything that you do, even your personal decisions, will affect everybody going forward. And if we don't think long and hard about our decisions around vaccinations, we run a risk of one day not having elders and the wisdom of the elders to draw on.
Well, all I can do is put some gaskianyok there, some encouragement there of keep practicing, taking care of yourself, your best of your ability. And even at the longhouse, like you said, we did things there that we don't usually do because there were people that wore masks. We had sanitizer all over the place, and they use gloves. A lot of us use gloves, and when they give out the food, they use gloves. Everything shifted. It's new for us, but we know we had to do it. And and people that were afraid to come to Longhouse, we said, that's okay, stay home. Nothing's going to happen to you if you stay home. And when we do our words, we include everybody in that, not just even in our Longhouse, but all the people that this big disease that come to go past us, go over us, don't affect our people, not just the ones at the longhouse, but everybody. So that's what we do. We do our prayers, but I just want to encourage everybody to keep practicing good health habits and to isolate, to stay home and do that part. So because I think that's what's going to be the best. And then if you're brave enough to get the vaccine, more power to you. I might get there one day too, but today it's kind of like, ooh, yeah. So I have to admit that too. I have to admit it to be able to deal with it. Yeah.
I know some people who gotten the vaccine, even their second dose, no third arm. Yay.
Nope.
It fell off, It fell off.
Yeah, it fell off already.
What about Ashley? Got any
Yeah, I think just encouraging people, ask questions from people that you trust, listen to the people in your community, your elders, your medicine people, your Western people. If you're unsure, ask the people around you, look at your heart and your spirit and see who has contributed to that. Who do I trust in my community and in my life to help me guide me through these decisions when I need encouragement.